All right, the warmer weather means more fun activities outside, but a lot of those activities can result in injuries, especially for kids. And those emergency room visits can be expensive, but there are ways to be more prepared. That's why we have Anna Van Dyne with Securian Financial here with us to walk us through some of the options. This will be so great for parents who watch. Accidents can happen anytime, of course, but why are kids at greater risk in the summer?
Well, now that school's out, kids are outside riding bikes, playing on the playground, and these activities can potentially result in injuries. A recent study found that 40% of ER visits for children's activities occur between the months of May and August. And even if you have medical insurance, those ER trips can be expensive. The average cost for a copay for an ER visit is over $400.
Oh, wow. Almost half, too, of those injuries are right when school lets out. All right, well, a lot of families then would assume that their insurance would cover a lot of these costs, but where do those unexpected costs pop up?
Sure. Well, many of us with health insurance for our families know that it can often come with out-of-pocket expenses, whether it's individual deductible, family deductible, copay, co-insurance. And with these unexpected injuries, it can often derail a family's finances if they have to tap into their savings or their credit card to pay those out-of-pocket expenses, which many families have to do. Additional financial protection with supplemental health benefits purchased through your employer can help prevent a financial worst-case scenario. Supplemental health benefits are purchased in addition to, not in place of, your health insurance, but overall they can help lessen the financial burden following an injury to you or a dependent.
Okay, yeah, that sounds like it would be something good to look into. So what are the different options for supplemental?
Sure, the most applicable are accident and hospital indemnity insurance. So for accident insurance, this pays a lump sum cash benefit following a covered accident. As an example, a few years ago, my daughter fell on the playground and broke her arm. Because she was a dependent on my accident plan, I was able to file a claim and receive a benefit for her broken arm. Alternatively, hospital indemnity insurance, this pays a daily benefit after a hospitalization. Depending on the severity of the accident or the length of the hospitalization, these benefits can pay out hundreds or even thousands of dollars, and cost ends up being equivalent to a couple specialty coffee shop visits per month.
Oh, okay, so you're still, getting charged for the visit, but it sounds like with this supplemental insurance, you're getting some of that money back. Am I understanding that?
Yes.
Okay, so a couple things to look into. How do people know if they have access to these through their job?
So I encourage viewers to talk to their HR staff or take a look at the employee benefits information, typically on an intranet site. More and more employers these days are offering these benefits, especially large employers, and you can often enroll for these benefits during your annual open enrollment, typically in the fall, or as a new hire or following a family status change.
All right, so you got to take a walk upstairs to HR. Anything else to know about these supplemental insurances?
Yeah, they can often work with each other. I am no exception to using these benefits. A few years ago, I slipped on the ice and severely fractured my wrist that required a hospitalization. Thankfully, I was enrolled in both accident and hospital indemnity, and I was able to file a claim under both plans. Overall, these are risk management tools. Take a look at your family's situation, your activity level, your medical history to see if they make sense for your family. Or if you have more questions, check out our website, securian.com.
Wow, some pretty common situations that these can help out with. All right, Anna, thank you so much for being with us, giving us these great tips. We'll have more about these tips at care11.com/noon.